Imagine Mary, a patient you've managed for years. Under the old system, her diabetes and depression gave her a certain risk adjustment factor, or RAF score. With the V28 hierarchical condition category model, Mary's RAF score may drop, not because she's healthier, but because the algorithm itself has changed. This is a major shift in how CMS evaluates patient complexity and predicts future healthcare costs. For primary care, this isn't just paperwork. It directly impacts your reimbursement and the resources available for your sickest patients. V28 adds and removes HCCs and redefines how diagnoses interact, so some conditions that once counted toward risk scores may now be excluded. Documentation habits that worked before may now leave patients underrepresented, affecting both care and payment. The challenge: adapt your documentation to this new model, ensuring it accurately reflects patient complexity. Your clinical notes are now being translated into a new language by CMS. If your documentation isn't fluent in V28, your patient's needs and your practice's funding may be underestimated. This isn't just about coding, it's about patient care. Mastering V28 starts with understanding what's changed and how to respond. The journey begins now. Why did CMS overhaul the risk adjustment model? Accuracy and fairness. The old V24 model was outdated, missing advances in medicine and changes in care costs. CMS also wanted to address coding intensity, the tendency for Medicare Advantage plans to code more aggressively than traditional Medicare. V28 aims to be more clinically robust, less vulnerable to upcoding, and better aligned with actual patient health. The transition is phased. In 2024, scores blend V24 and V28. By 2026, V28 will be the sole standard. The goal: ensure taxpayer dollars go to plans managing truly complex patients. This isn't arbitrary, it's a calculated move to improve the system's accuracy and resilience. Your role-aligned documentation with V28's demand for clinical specificity. Precision in records is now essential. V28 brings sweeping changes to ICD-10 code mappings and HCC categories. Over 2,000 codes that once adjusted risk are gone. Diagnoses like protein-calorie malnutrition and some anginas no longer count. Many HCCs are merged, so only the most severe specific conditions impact the RAF score. Disease interactions that once boosted scores are now limited. The focus is on severity, not just comorbidity. Simply listing problems isn't enough. Document the exact type, severity, and complications of each condition. V28 also narrows what's eligible for risk adjustment, increasing audit scrutiny. Every diagnosis must be backed by clear, objective clinical evidence. The margin for error is smaller than ever. Your documentation must be precise, defensible, and up-to-date. The stakes for accuracy have never been higher. V28 transforms daily workflow. Specificity is now non-negotiable. You must document not just diabetes, but its type, control, and complications. Pre-visit planning is crucial. Review charts for missing details and update diagnoses with V28 required specificity. CMS now relies on encounter data, not just diagnosis codes. Every HCC must be supported by a face-to-face visit and clear documentation. Problem lists from hospital summaries aren't enough. Each condition must be actively managed and documented during the year. Annual wellness visits are now prime opportunities to review and update all chronic conditions. The new mantra: if it wasn't assessed, monitored, or treated this year, it doesn't count. Adapting your workflow is essential for both compliance and patient care. Precision in every note is your new standard. With fewer HCC-eligible codes, audit risk rises. Auditors will scrutinize every diagnosis for meet criteria: monitored, evaluated, assessed, or treated. Vague or unsupported diagnoses are now major liabilities. Encounter data gives auditors a full view, making inconsistencies easy to spot. The burden is on you to prove each condition is actively managed. Regular internal chart reviews and staff training are essential to ensure compliance. Your goal documentation is so clear and specific it's virtually audit-proof. In V28, robust records are your best protection. Adapting to V28 requires a proactive, team-based approach. First, educate your entire staff on what's changed and what's required. Update EHR templates to prompt for the new specificity, especially for chronic conditions. Make pre-visit planning routine. Review charts for missing or outdated details. Focus on high-impact conditions like diabetes with complications, major depression, and vascular disease. Conduct regular internal audits to check for meat compliance and documentation gaps. Use audit feedback to improve provider habits and resilience. Strengthen your assessment and plan. Every note should clearly show how each condition was managed. Follow this checklist to protect care quality and financial stability. For more, seek out a comprehensive V28 guide and checklist.